Once again, good morning and welcome to 1 Million Cups Kansas City. My name is Courtney and I'm here with Toby and Milton. We are your community organizers, -2 this morning. So we are a weekly entrepreneurial program. We host 2 presenters every week. They present for about 6 minutes, and then we open it up to the audience for Q&A. So if you would like to ask the presenter a question, please raise your hand and we will come around with a mic. To get started, I would like to introduce our expert panel this week. If you guys just want to grab the mic and introduce yourselves this morning, it'd be great.
Hi, my name is Jade Gerbena with Cavu Healthcare Systems.
And my name is Michelle Markey, and I'm with Kauffman Foundation, Kauffman Fast Track.
Thank you so much. So they will start off our Q&A, and then we will open it up to the audience.
Callie and I are both in pipeline in the fellowship class this year. So you spend a year in the fellowship. People always ask me what is the amount of time really that you have to spend. How can I be building my business while I'm participating in this fellowship? And it's so minimal, really. You go 4 times a year for a few days in a module where you leave your business and you get around people who can really help you solve problems. We've had so much fun, and we have 13 members in our class, and I can't tell you how close we've all become, but my business isn't even the same name or the same business as where I started. Thank God, because I would have spent 2 years on a business had I not had pipeline and failed really miserably. It was one of those things where in the first module you had to identify who your customer was. And when you can't answer that question, it sort of hits you in the face that maybe you don't have a business. So I spent module 1 in the bathroom, bawling when this occurred to me, trying to figure out what it was I just did. I just quit a corporate job and I had this business. And within that group and sort of identifying our business opportunities, I've come up with a new business, and we'll talk about it at Million Cups a little bit later. Been able to close over $1.3 million in funding, and we're getting ready to launch in a week. And none of that would have happened without pipeline.
Yeah, I mean, I would just reiterate what Laura said. When people ask me why to apply for pipeline, I kind of want to look at them and be like, just be quiet and apply. Like, just apply, go through it, and then you'll know at the end of the year. Because I'll be honest, when people were pushing me to apply, I was like, ugh, another thing to take my time. Awesome. And then I applied, and it's the greatest decision I've ever made. I still thank my advisors that called me and said, Callie, you have to apply. Get the app in. Get the app in. I still thank them for pushing me in that direction because, as I kind of noted earlier, it's really, really helped me. But one of the greatest things is that it doesn't suck your time. And accelerators are great for certain stages of business, but I'm in a stage of business where I'm so busy that I can't give up every single day of my, for 3 months, for 8 hours each day. But this is perfect because there are 4 modules where I can actually take myself out of my business and do something that most of us don't do, which is work on your business as opposed to work in your business. And that opportunity to work on your business is one of the greatest opportunities I've had to date in running my business.
Yeah, so there are 7 days left. You have about a week. We both approached it the same way. When I applied, I had no idea really why I was applying, and then when I got accepted, I was really not sure what it was, and they asked me to give them my resignation letter for my corporate job before I showed up, and I thought, God, I was gonna go check it out first before I did that. And it was really that moment in time when I look back at it, when I decided, well, am I gonna stay in the corporate world with my safety net and do this as a side business, or am I gonna commit wholly? And committing wholly is what is going to give me the opportunity to be successful. Just apply. Some of you in this room, Ben, Tommy, are people who don't have your applications yet that are going to apply. Ben, Tommy, and I need you guys to get those applications in by the end of the week so that you will have the opportunity to meet all of the fellows and to have the network that Callie and I have now. So thanks. Sorry, the video was super cool.
Just go to the website.
Yeah.
Thank you, Laura. Thank you, Callie. Let's hear it for Pipeline. Okay, just a couple more quick announcements before we bring you up. I'd like to have Emily Thatch come up to the stage. She's going to help us with a special announcement for next week.
Good morning. So next Wednesday, the Kauffman Foundation and the British Consulate are teaming up to host an event here about innovation and entrepreneurship in the United States and the United Kingdom. So next Wednesday, after 1 Million Cups, stay in your seats and you can learn more about the differences in support for entrepreneurship and innovation in the UK and the US with a focus on funding, access to capital, and effective policies. So we hope you can stay and join us. Thanks.
Thank you, Emily. Very quickly, an announcement for the Inventor Center of Kansas City meets the third Tuesday each month at 6:30 p.m. And so next meeting is coming up Tuesday, October 20th at the meeting room here across the hall. And did we have an announcement from Jacob today? Is Jacob here? Maybe not. All right. Well, without further ado, I'd like to introduce Kylie and Hasib from Health Suite 110, which is a direct primary care co-op. They're going to come and tell us all about it. Thank you. Let's welcome them to the stage.
Thank you. Good morning, everyone. Imagine you want to go on a whitewater rafting trip. You think it's a fantastic idea. You go there, you end up hurting your arm, and the whole process begins with the healthcare, right? The calling of appointments, the waiting times, and my God, the forms. And you finally get in there, the doctor finally says, after a 7-minute visit, says, I'm not the guy, you gotta go see somebody else. And you say, oh, God, I gotta do this whole process over again. Well, Dr. Vanham and I are here to share with you a solution that says this process really doesn't have to happen. There's a huge and a more significant and a better way to do this. Good morning, everyone. I'm Dr. Hasib Ahmed. I'm a board-certified internal medicine physician, president of Live Active Primary Care, and co-founder of Health Suite 110. I was a hospital medicine physician for about 8 years, did various different positions, tried to change healthcare as hard as I could from the inside, and I said, you know what? It's going to take something more exotic, something more crazy, something more aggressive to change this. And that's when Health Suite 110 was born.
Good morning, I'm Dr. Kylie Vanneman. I'm a family medicine physician, been practicing outpatient primary care for the last 10 years, both here and abroad, and I've seen firsthand how important primary care is and how much better our populations and our patients do when we have a strong primary care at its base. So we're here to talk a little bit about the problem and the solution. First, the problem with healthcare here, and it really starts with primary care as we know it. So let's think about it at the patient's perspective. We all know that a lot of times healthcare can be intimidating due to our insurance-based system. It's often inaccessible, it's costly, and it's impersonal. We all know what it's like to try to get an appointment when we need one and how easy or hard that might be. We know the frustrations of the phone trees and talking to numerous people, the long waits once we get to the office. The costs, not only with the premiums, but with the co-pays, and then all the unknown costs. Once we get there, we never know what anything's actually going to cost. And then the impersonal nature of it. We all know we call, we make an appointment, we tell our story once to the scheduler, we tell it again to the front desk, we tell it again to the medical assistant, and then maybe we tell it again to the doctor who's so busy that they often spend most of their time looking at the computer rather than looking at us. By the end of that, we feel like we're known much more by our disease rather than by our name. Doctors aren't happy in the system either. Due to the way that most doctors get paid, we are required to see more patients in less time. There's more paperwork, which allows us less time with patients, which leads to the primary care shortage getting worse as physicians that are practicing get burnt out and leave medicine. Medical students see what's happening, and less of them are choosing primary care as a specialty. In fact, by 2025, it's estimated we'll be short over 124,000 primary care physicians. So what might an insurance-free solution look like? Well, for the patients, it would look like 24/7 easy access to a doctor who knows you. It would look like our clinic. It would look like transparent and affordable prices. And it would look like personalized relationship-based care. Our solution extends not only to patients, but to businesses and to other physicians as well.
Nearly half of Americans get their health care benefits through an employer. We know the benefits of a well workplace, right? Increased productivity, more job satisfaction, motivation in the workplace. We get it. And so it's the solution from Health Suite is very simple. Business model is very simple, actually. We have a fixed flat rate for the employee and their families. What that does for the employer is fixes that healthcare budget for the entire year. They know exactly what the cost is going to be. And for the employee, all of a sudden they have all sorts of open services for primary care, affordable, accessible, and high quality primary care. In fact, I'll be talking November 3rd about wellness in the workplace right here in Kansas City, and you can go on our website to learn more information about that. But we also had another problem that Dr. Vandeman kind of talked about, right? 124,000 primary care physicians deficit by 2025. It's a problem. What's the solution? So we went further. And HealthSuite makes it very simple. In our model, physicians will be able to be autonomous. You can be an autonomous physician, practice in HealthSuite, share the resources, invest, and enjoy the benefits of a culture of teamwork, cooperative primary care. Patients are the recipients of the benefits of a talented work group where we recruit physicians who are highly talented, but here's the fun part. We recruit physicians who have talents outside of medicine. So what does that mean? We have meditation classes every Wednesday night. If you're on our Facebook page, you see us meditating outside. We do empowering lectures whenever we can. We go to the workplace, we give empowering lectures, health talks. We're having book clubs, walks, hikes, riding bikes, runs, anything to empower the community. Because to be honest, the health of our community, the health of all of us in this room, depends upon it. So we'd like to take HealthSuite also to other places around Kansas City. We want this opportunity to be available for physicians. We want to increase access to our patients because we recognize being in Overland Park, it's not feasible for somebody from, although we do have patients from Parkville who drive over, or north of the river, Lee Summit, they come over, but we'd like to expand. We'd like to put this model in all parts of Kansas City. Physicians are going to be autonomous. That's what medicine was founded upon, to preserve and protect that relationship with patients. And they'll enjoy that teamwork culture. So there are a lot of rough waters ahead of us in healthcare. We get it. We see significant changes being made. But unfortunately, there have been several physicians who have dropped out of the boat. They said, hey, I can't do this. I'm done. In the process, we've also seen patients fall off the boat because they feel abandoned. They feel alienated. But you know what, Dr. Vandeman and I, we choose to stay on this boat. We choose to lead our community to get accessible, affordable, and high-quality primary care. We choose to lead our physicians to better opportunities to reclaim what medicine was founded upon, which was autonomy and protecting and respecting that patient-physician relationship. Folks, our message is very simple. As alienating as healthcare can be, here at HealthSuite, relationships will always matter. Thank you very much.
Thank you so much for presenting. Before we open it up to a panel, I just wanted to say really quick, I think over the past year, we've only had one other company come and present the primary direct care model. And they said that the number one thing is it allows doctors to do what they really love to do, and that's take care of patients. So that's awesome that you guys are here presenting today. We're going to start with Jay from Cavu Healthcare.
Hi, I have a dozen questions, but unfortunately we don't have enough time for that. I guess my first question, I've loved the model, I understand this, coming from the healthcare background, from the actual being in the hospital to actually being with the insurance companies. I understand the challenges that are faced with our population, especially when it comes to primary care. My question to you is this, and it's not a softball. With direct primary care or concierge medicine, and practitioners on average seeing 50 to 75% less patients than your counterparts, which is a better thing, you spend more time with them. How do you address the lack of shortcoming of practitioners coming in 2025 when there's going to be even less of time to see more patients?
Well, there's a couple of things. That's a pretty loaded question, but I'm going to attack it piece by piece. So in our model, we cap at 600 patients, okay? And that's how we can offer same-day, next-day appointments. That's how we do texting and emailing and et cetera. You can call me. People have my cell phone number. But the model of Health Suite, which is really unique, is that it brings more primary care physicians into that culture or into that unit, into that entity. So now all of a sudden you have 600 patients per physician who will be seeing each individual. And so they can offer more time with our patients. So what that translates to in practicality is our visit times, to be honest, could be 30 minutes to 2 hours. I've spent 2 hours with the patient because I can. Our waiting rooms, as you saw, are not rustling and bustling. I mean, it's interesting. We're turning healthcare on its head. We're saying, rather than paying me by volume, pay me to keep you happy and healthy and for you to live a high quality life. If you're not happy with our services, then you should be welcome to go and get another physician. And so our contracts are never binding. And so our patients always have the ability to say, I'm not happy with the service, I'm gonna go somewhere else. Does that answer all the
Well, I guess
questions?
the other side of it is the numbers game, right? Well, the current system is what's causing the crisis. So, and more and more people are leaving primary care. I mean, that's a problem. In the practice that I was at previously, there were 12 of us primary care docs, 6 of us left in 1 year. I mean, so we have to turn that around, and we have to encourage medical students who are interested in and passionate about primary care to go into primary care because it's not a dead end, and they're not going to bail after 5 years of practice. So, and the other side of that is in other countries that have a strong primary care base, 50% of their physicians are primary care and 50% are all other specialties combined. In this country, about 70% are specialists and about 30% are primary care. So if we can draw people in by offering this sort of model, I think it'll really turn things around.
I want to say I totally agree with your model. I'm totally on board with that. I'd like to talk to you further about that. One of the other questions I have due to time is, how does the ACA affect your business model? And I'll just leave it to that.
Yeah. Well, I think the other group that Milton was talking about that came to talk was Atlas MD in Wichita. We love those guys. They have been an inspiration to us and a big help in getting us started. And Dr. Josh always talks about how he loves the Affordable Care Act for lots of reasons. But I think a lot more people are finding that they're turning to high deductible plans, and they're finding ways to make trying to find ways to make their healthcare affordable. And so more and more people are paying out of pocket, and that's meaning something more to them. So when they're using their own dollar, they're going to spend it in ways that they find the most value. So for us, we work really well for folks that have high deductible plans, that have huge copays, where they can come to us. There's no copays, it's a flat fee, they know what they're getting, they can save their health savings account money for the big expensive things and invest the smaller amount in primary care.
And the market is really pointing towards higher deductible plans. The deductibles get higher, and the out-of-pocket Medicare expenses, which a lot of folks don't realize is significant. Premiums continue to go up. The average Medicare out-of-pocket expense is around $5,500 for a 65-year-old. Expenses continue to go up annually as they get more hospitalizations, et cetera. So there's so much we can say about that. So yeah.
So is your target market getting businesses to, is it businesses or individuals?
Both.
Both? And so if I'm the individual, am I paying double then? I'm paying for my regular health care plan as well as I'm paying for yours. Is that
Yes.
correct?
Yeah.
So I'll just say we just have a flat monthly fee, okay? And here's what I say. So my weight loss patients and my diabetics are good examples because one of the things they always say is, Dr. Ahmed, you're the first person that keeps me accountable. And what they mean by that is I see them every 2 weeks. I see some patients every week. In a traditional model, they'd have to pay a copay every time. They'd have forms, et cetera. For me, I don't need that revenue, right? And for me, it's more of, let's get the blood sugars under better control. Let's get them to lose weight. Let's talk about barriers. Because to be honest, in the clinic, patients don't reveal everything the first visit. You need that second, you need that third visit. You need the wife with the husband. And then you tag team and say, you need to, what's the truth here? It takes time. So I can't say, hey, you need to go see a dietitian and you need to work out. I'll see you in 6 months or 3 months, check your lipid panel again. It doesn't work. Let's see you in 2 weeks. Let's talk about how did it work. Did you fit in your exercise today? Did you do this? No, I didn't. Well, let's try something else. Let's try this. And that's how you work at it.
I have kind of 2 follow-on questions if there's time. Are you willing to talk about your pricing schedule?
Oh, yeah, sure. So Yeah, so it's based on a monthly membership price. So kids 0 to 17 are $10 a month with a member. Yeah. Age 18 to 39 is $50 a month. 40 to 59 is $75 a month. 60 to 99 is $100 a month. And then if you're 100 and over, you're $1 a month.
Excellent. Got to get to that age. So my final and follow-on question, I noticed that they have your cell phone numbers, they have your email, they have you 24/7.
Absolutely.
And there's only 2 of you. So I'm wondering, that kind of direct access is really unprecedented. So, but I think it's part of the culture that you're establishing there. What kind of feedback have your colleagues and potential people that would join you as physicians in this effort, what has their feedback been?
I'll share mine, and then Dr. Vanman can share hers. So many people are excited for what we're doing, and we always market our opportunity, and we say, when companies do sign up with us, we get 50 patients or however, which is also interesting. We found out as we walked the pavement that people who are less than 50 employees also want to offer something to their employees to prevent that indirect cost. But so they're excited. They're going to watch our success, and hopefully they'll plunge. And it's going to take them watching our success and growth, and they'll completely join in. The common question always, in my concern, was the 24/7 availability. But it's interesting. When people know, I can call Dr. Ahmed right now, and he's going to answer that phone. They're going to say it's dinner time. I'm going to call him probably tomorrow morning because I know he's going to pick up. Or I know I can see him in the office tomorrow. It's really not a big deal. When people have that, perspective, or they can say, I'll say, text me your blood pressures. I'll say, just text me your blood pressures because then I can adjust your dose. You don't need to come in. Just tell me your blood pressures. That's actually a better way for outpatient blood pressure monitoring. There's an article in the Washington Post just the other day. But that helps patients, and they appreciate that, and they're very respectful of it.
Yeah, most people that hear what we're doing think we're crazy, and I thought the same thing. And so, before we decided to do this, I asked all my, different people. There's doctors all over the country. There's over, the numbers are growing, but over at least 12,000 docs that are doing this. So there's a lot of people that have gone before us and that are learning and are very willing to share their experience with us. And so that was my sort of number one question: is like, what is it like being on call 24/7? Because I know what it's like to be on call for a night, or a week, for a group. But it's different, I think, when they know that it's going to be you, and it's not going to be some call center. It's not going to be a nurse that's, on shift or something. They know it's going to be you, and they have to face you on Monday morning, that they called you at 2 a.m. on something. So I think that makes it more personal, and patients appreciate knowing that you're there. So I think just knowing that we are available can help allay some concerns from the patient, where they don't have to worry about something all weekend. They know if it really gets bad, we're there for them.
Or our meditation class gets extra long because we
Yeah.
need to.
Got a question on the left back here.
Hi, Doug Wager, survivor of 19 years of healthcare IT and witnessing the problems that you guys are trying to fix, and I applaud you for taking a different approach at it. The question I have, to kind of follow up, Jay mentioned the problem of scale, and if you can see fewer patients, can you still solve this problem of healthcare needs expanding? And maybe you can if you prevent a lot of people from getting sicker. That may be possible.
Right.
But you also mentioned in your presentation, you said one of the problems is this handoff. I go to the primary care provider, and then I get just punted to a specialist. How does this help solve that problem? Because I still imagine you're not fixing the specialist problem.
Yeah, so I love specialists. I have many specialist friends, but we often use them in times that we don't necessarily need them. As primary care trained physicians, we are trained to take care of 80 to 90% of your healthcare needs. If you need a knee replacement, I will send you to my friendly orthopedic surgeon, or you need, heart cath, I'll send you to cardiology. But if we have the time to spend with you to get to the root of the problem and to discuss things and to think thoughtfully through things, we can manage it. So I think a lot of people aren't aware of that. They think if they have diabetes or thyroid problems, they have to see an endocrinologist, or they think if they have arthritis, they have to see, ortho or something like that. So we're re-educating that primary care is a lot more powerful than people realize, because they've been so used to what poor primary care or rushed primary care looks like. So we're redefining that.
Question here in the front.
Hasib, do you have a meditation tonight? I should think if you made that mandatory for all your clients, they'd be well in after the meditation.
6:30 tonight, right at our clinic.
6:30, and
That's right.
are we all invited?
You're all
Everyone's
invited.
invited, yep.
There.
We have a question on the left in the back here.
So where are your early adopters for this model coming from? Where are you looking to get the initial success and validation with this? Because I think one of the challenges must be how does this coexist with regular health insurance, because it's not a replacement for health insurance. So where are your early adopters?
Well, so I practiced here in town for a while before we started this, and so I think most of my early adopters were patients that I had previously, and then honestly, just people that I've met that know me. That's sort of been the biggest seller, I guess. And people ask about the insurance thing all the time, and you know, we coexist actually fine with insurance. I mean, you hear our prices; they're not astronomical. We encourage people to have insurance, you know, so when you do need something like surgery or a specialist thing or hospitalization, that's what insurance is for. But, you know, if we look at how we use all of our other types of insurance, how we use our car insurance, our home insurance, we don't expect our car insurance to pay for our windshield wipers or our gas in our tank, you know, but we expect healthcare to pay for our strep throats and our preventative medicine. And that just doesn't make sense, but that's what we've all been trained to do. So again, insurance works well with us, but we just need to use it appropriately.
And some folks, for me as a hospital medicine physician, I didn't have a previous outpatient practice. So if I provide excellent inpatient care, you know, it would really bother me when they would say, can I come see you in the office? And I would say, no, I just work in the hospital. But now I can say, come to my office. But then I have to go the extra step and say, well, this is how the practice works. And then that's a common question is, well, I'm paying my premiums, but I'm going to pay this extra fee. What am I going to get it? So one of the things we didn't touch on just because of time was just the value of that monthly payment that our patients make. We literally seek and make as many handshakes as we can. We bring resources to our patients. So in a traditional model of me saying, go see a dietitian or go see a fitness trainer, it's more of me calling my dietitian or my fitness trainer and saying, call Joe because this is what we're working on. Same thing with imaging and our lab partners and our pathology partners. We negotiate, we meet with CEOs and we say, what's the cash price and what's the price for our patients? And the cost becomes ridiculously
Yeah, a
lower.
lot of times when we give patients the option of either paying out of pocket or paying their copay for their labs, they'd rather pay their $1.45 for their CBC through us or $2 for their A1C through us because their insurance, their 20% copay is going to be much higher than that. So there's a lot of other added value cost-wise that we provide as well.
It's all about empowerment, empowering the consumer to say, I can use my insurance or I can pay the cash price, whatever you want to do. I mean, we can bill or we can send a lab through Medicare, whatever, however you want, but you have options.
I have a question from Twitter from Bob King. How do you compare or contrast your model with remote care solutions such as Doctor on Demand?
Can you repeat the question? So what's our...
Compare it to like telemedicine.
Oh.
So, I mean, we offer telemedicine, but I think telemedicine works really well when you already have a relationship with the patient. I'm not a big fan of telemedicine for a doctor who's never met a patient before. I think it's dangerous. I think there's probably overprescribing because people are expecting to get something for their money. So we do telemedicine, but we offer so much more than that.
So all our texting, all our emails goes through the EMR, gets documented into the EMR, and obviously we communicate like that.
I have another question in the center.
Oh, yeah.
So knowing a little bit about the number of patients that you all serve and as well as kind of the fees that you charge, we can kind of approximate what your revenue would be. But what about costs? I mean, running a practice is not a cheap deal. So kind of what are your costs, and as you scale, how does that play a role?
Oh, I have to get this one.
Go for it.
Okay. So in a traditional practice, 60% overhead is staffing, software, and then all the bills that get denied, and then you resubmit. And so your accounts receivable really dramatically increases. And then on top of that, you have your accounts payable, right? Whether you're leasing or you're buying your property, and then the equipment. So people will have an X-ray machine, or they'll have something pizzazzy to lure patients to their practice. We don't do any of that. It's really brain, hands, and feet. And it's a very lean model. Because we don't need that. We're not billing insurance companies. So I can take that 60%. I can do a couple of things with it. I can put it in my pocket, right? Or I can add value to it, kind of a Costco model. I can put it to my consumers and say, this is the value that you're getting. So for example, our imaging and our labs and our wholesale medications, you can get medications at our office for 87 cents, which you would probably pay $6 or $7 a month, or $92, we give it to you for $11 because we deal directly. So it's direct care for that reason. And so it's a very lean model. The cost is very low to survive, and so that's how we operate within a low-cost, lean model.
Yeah, currently it's just the two of us. As soon as we meet our sort of patient threshold, we'll hire another clinical staff person. But we answer the phones, we vacuum, we clean the toilets at the moment. So it's a very lean model, but we don't have that whole billing department. They estimate that you spend about $80,000 per physician per year just to bill. So in a traditional model, that's how much you're paying per doctor. We don't have that because we're not billing insurance. We're just doing the flat monthly fee, and so we don't have all that overhead.
We have a question in the middle in the back.
I think this is an awesome idea, but I'm curious how you're using technology or how you'd like to use technology. A lot of people are looking to mobile health to disrupt healthcare, all the data, everything that your phone knows more about you than you do. Are you using anything, any technology to help you out or help your experience, or are you looking to do that?
So our EMR is pretty cool. Our Fitbit technology, any human API, iHealth products, iHealth blood pressure, glucometer, whatever, syncs in with our EMR. So I can see live data if you choose to use it. Some of my patients do use Fitbit quite a bit, and so I can look at their, but again, the data you have to be speculative of because it's not accurate data. It's maybe precise, but it gives you another tool to steps, hours of sleep at night, things like that. Texting and emailing is great. We use a lot of, even just from an operational standpoint, just to use iCloud storage for forms and all this other. So that's the other cost perspective. We're not printing out all these forms. And actually, our patients, we greet you at the door. You text me like, hey, I'm 30 minutes away. Can I come see you? Sure. Hi, I'm Dr. Ahmed. There's no nurse to fill out forms or anything because we have everything loaded up and I know you. So
one of the most common things we probably use are like if people take photographs of things. I see kids, so I get lots of emails or calls about rashes or various things that pop up. And so I have lots of parents, instead of hauling their kid across town to come see me, they just take a picture. And I can usually diagnose most things over that. And if not, then they come in. But that often saves people a lot of hassle instead of having to pile all the kids in the car.
that's a good point. Like the oak tree mites, I just had a couple of cases already. I mean, we've seen that in the news as well. So you don't really need to come in for that. Pick up your steroid cream or something, but yeah.
We just have one more question, and that is, what can this community do for you all?
Okay, we're so glad you asked. So as you know, we're trying to grow. We just opened July 1st, and it's all word of mouth, really. And so what we would love is introductions to small businesses, especially those that have 50 or less employees that aren't mandated to provide health insurance, but want to, but find it unaffordable. We have several companies that are doing that and providing our services. Either the employer's paying all of it, or they're sharing some of that cost with their employees, but that's been very successful. So anyone known as a small business. We'd also like to get in more with the elderly community. So if anyone has any connections with groups, this is a group of people that's quite vulnerable, needs more time, and often doesn't have it. We do house calls, we do nursing home visits. So if anyone has any connections there. And then also any introduction to other primary care docs who you think this might be a good fit for, who are still passionate about taking care of people but are sick of the system. So before they fall off the boat, please introduce them to us. And then also anyone that has connections with specialists or any other ancillary services that we might need, an imaging service or wholesale medications or podiatry, anything that we might be able to discuss some cash pricing, we would appreciate that.
Great. Thanks very much, guys. That is 1 Million Cups for this week. Thanks so much for coming. We'll be back here next week from 9 to 10 on Wednesday.